Toddlers' fussy eating habits are more to do with genetics than poor parenting, experts have found. Scientists at University College London examined the eating habits of more than 1,900 pairs of twins. The toddlers, aged 16 months, displayed huge variety in what they were willing to eat, but the researchers found this was more likely to be influenced by genes than upbringing. Writing in the Journal of Child Psychology and Psychiatry, they said, during early childhood, children are gradually introduced to an increasingly varied diet comprising previously unseen foods of different flavors, textures and visual characteristics. While some children willingly accept new foods, many are hesitant. Twins were used in the study because each pair grew up in the same home, brought up by the same parents, meaning the researchers could take environmental impact to be constant. Food fussiness, the tendency to be highly selective about the textures, taste and smell of foods a child is willing to eat, is frequently seen as a consequence of inadequate parenting. However, food neophobia, the refusal of many young children to try new food, is often seen as a normal development stage rather than a result of parents' behavior. Andrea Smith, who led the research, said establishing a substantial genetic influence on both of these traits might be quite a relief to parents, as they often feel judged or feel guilty for their children's fussy eating. Understanding that these traits are largely innate might help to deflect this blame. However, the importance of genes does not imply that children's fussy eating behavior cannot be changed. Co-author Dr. Claire Llewellyn added, "Genes are not our destiny. We know of many traits with a strong genetic basis that can nevertheless be changed, such as weight." It would be useful for future research to identify the important environmental shapers of food fussiness and neophobia in young children so that they might be targeted to reduce these behaviors. Mothers often responded to a fussier twin by pressurizing their child to eat induced favorite foods as a reward for disliked foods. Holly Harris of UC said, "Parents often comment on how different their children are, and so it makes sense that they vary their parenting strategies to suit each individual child. Having a child who refuses to eat most foods can be very distressing for a parent. A logical next step is to work with parents to address their concerns and develop strategies to best respond to a child's fussy eating to encourage future food acceptance."